Welcome to Legends with Bevo. Thanks to the Holdy Hotel, Coopers, and Anytime Fitness Glenelg.
Well, g'day, welcome to our very first ever online version of Legends with Bevo. And the coronavirus is certainly affecting everyone around the world at the moment. And seeing an amazing job by all the health workers and particularly doctors, nurses, and we just can't say how thankful we are to all of them. Lucky enough to be joined today by a friend of mine in the Riverland, Dr James McLeod. He's a rural GP up there. James, great to have you on Legends with Bevo. Obviously, not the best circumstances to have you on, but good to get you on nonetheless.
Yeah, thanks for having me on, Bevo. Hopefully we can give the general community a bit more information about things, maybe dispel some myths and help everyone stay safe.
And obviously you've been a medical practitioner for a long time now. Talk us through your background and how you ended up in the Riverlands.
Yeah, so I did a medical science degree at Flinders University first, and then got lucky enough to get straight into medicine and do that at Flinders Uni as well. After that, during my clinical training, I went out to Renmark for a year and had a great time out there and really loved it. And then come back to the city and did extra training at the bigger hospitals in Adelaide, and then ended up doing general practice training and have stayed out in the Riverland ever since. So yeah, I've been out here for about 6 or 7 years now, and absolutely love it. Got a great team at the clinic we're at, and raised a family up to 3 kids now. So yeah, life's busy.
And most importantly, how are you guys coping up there with the coronavirus so far?
Yeah, so at the moment, we've spent at our clinic spent the last couple of weeks trying to just get prepared for what's going to come. We've had a bit of insight into what we might face if we don't prepare properly. If you look at what's happened in Italy and now Spain, and even in America now, with especially New York, we've got some just disaster cases you can hear from over there, because they haven't been able to get good control of the virus, and their hospitals are just absolutely swamped. It's just been absolutely tragic what's happened there. So we've had, we've been looking at what's happening over there and trying to, as they say, get ahead of the curve and get ourselves prepared. It's been a very taxing couple of weeks. The government's been working absolutely flat out to give the best recommendations they can at any given time. So even just in terms of who to swab, we're up to update number 14 of who to swab. So every few days we're getting new information, new guidelines. It's not like anything we've ever seen before. Lots of people have been critical of the government, and there's still things that me and my colleagues think they could do better. But I mean, it's an unenviable task they've got, trying to gather information on a virus we don't know much about, trying to assess epidemiology on the fly and provide safe guidelines. Every few days, it's a massive undertaking.
Yeah, you do feel for Scott Morrison. Obviously, he's had the bushfires to deal with first and cop his criticism with that, and now this as well. Like you mentioned, it's nothing that I've ever seen before. So, I personally, I think he's doing an okay job, and he's getting this advice from medical officers. So, everyone's had their own opinion, which is fine. But yeah, you got to feel for the guy. He certainly must be losing a lot more hair and going greyer by the days, I think. So.
It's a tough gig. I said to someone the other day, do you remember that we're actually in a drought? And remember we just had those bushfires? And I mean, there's a lot of stuff that had been going on prior to this, and it's just, you hardly hear anybody even talking of it anymore, and for good reason. This is going to be massive, and it's completely changed the way we live already, and it's going to continue to shape our lives for who knows. It could be 3 months, could be 12, could be 18 months. So I think, a lot of people are a bit confused as to what to know. There's probably a lot of people who have lost trust in the media, and unfortunately, I think on this occasion, there's still a lot of people thinking that, this is all just fake news and it's all just made up. It's not. I mean, you've got a massive loss of life already from this. If ever you'd sort of endorse the media going over the top with something, this is sort of when you'd say, definitely listen to what's on the media, and even if they hype it up and get everyone scared, well, good. People should just be staying at home and looking after themselves and not spreading this virus.
Yeah, I mean, obviously you've just mentioned just then with people staying at home. What other things are there, to reduce the risks, James?
Yeah, so I think staying at home is the idea with that from a public health perspective is that if we're all staying at home and really limiting our time socialising, or actually not socialising is ideal, in terms of going out and about to go to the shops or whatever, if you can stay at home, it just really reduces disease transmission, because this virus is just amazing. It really is. For a bit of a nerd like me who's done some molecular biology and stuff in undergrad, it really is amazing, the pathogenicity of this virus. It's incredible. It's like nothing we've seen before. And staying at home means that basically will slow its transmission. I don't think over a long enough timeline that we'll actually be able to sort of stop it. Until we get a vaccine or some sort of miracle drug. But any of those sorts of things are going to be, at best case scenario, we'll get to maybe end of the year. It's probably going to be like middle of next year before we really get anything. So staying at home is really important. Not only do you protect yourself, you're protecting the community.
And in terms of like people that, like myself, that are currently working at supermarkets, and my partner Kelly, who's a teacher, what sort of things can we be doing to, I guess, put ourselves at less risk of getting the virus, James?
Yeah, so there's a few different things. Obviously, Scott Morrison and his crew have been talking about social distancing. That's going to be really, really important. This virus actually spreads just by our breath. So instead of most viruses where you have to actually cough or touch your mouth and touch something and then someone else touch it, this one, it could be, if it wasn't for Zoom and we were just talking face to face and I had it, you'd probably already have it just from talking. Yeah. It just spreads by a very fine droplet. The social distancing is really important. It really just reduces the chances that a virus can make it from me to 1.5 metre away you. So that's a really big important thing. The other thing would be that if you go into the shops, you work at the shops, hand hygiene is incredibly important as well. As I said, if you touch your mouth or anywhere around your face where the droplets could land and then it's on your hands and you touch something else, if another person touches that, potentially they can give it to themselves. So we think that the virus, if you're in a closed room like I am now, if I was breathing out the virus, it might remain just hanging in the air for even up to 3 hours. It could even be longer. In terms of how long the virus can survive on different surfaces, we think that if it's on a surface like cardboard or clothing or something like that, the virus can probably last about an hour. Whereas if you've got a polished surface, so a plastic, say, desktop or just a bench top, or even if you're at the shops and you've picked up a can of vegetables or something and someone else has already touched them, it can potentially live on a polished surface like that for 3 hours or longer. So yeah, in terms of yourself, hand hygiene is really, really important, because I mean, if you go to the shops and you've picked up a whole lot of fruit and veg and you just get stuck into it without washing your hands, you don't know what you're putting in your mouth, basically. So there's distancing, there's hand hygiene. I guess on hand hygiene, people have done a massive rush on buying alcohol gels, and that's good because alcohol gels do work really well. In saying that, that's caused a massive shortage of alcohol gels. We've been lucky enough out here in Renmark to have a local distillery and winery, Angoves, actually make us massive quantities of 70% ethanol, because without that, we would have had a lot of trouble trying to source alcohol gels. If you can't get alcohol gels, don't panic. Washing your hands really well with soap and water for 20 seconds or more is really, really good too. And when I say wash your hands like a doctor, basically. Get them back and forth in between, and then just keep going up your arm as well. If you're really worried about people that have been breathing on you, so if you're like me, if you get out from the shops or get home from work, I've actually just washed my face, my ears, my neck as well. Anything where you think it could get to.
Yeah, it's all great advice. In terms of the symptoms of the virus, obviously we've heard different things, like people saying that if they have headaches or sore throats and that sort of thing. What are some of the other symptoms, James?
Yeah, so I guess the tricky thing with this virus is that a lot of people are not going to have any symptoms at all. And that's why it's such an amazing virus in terms of how it spreads. If you're lucky, you'll have this virus and hardly even know that you've had it. The incubation time, like if you were to just breathe on me now and give me the coronavirus, there'd be a 4-day window where I'd have no symptoms at all, but I'd be breathing out the virus. And that's why it spread like crazy, because it's just this incubation time where you're breathing it, you don't even know. Other colds like influenza and rhinovirus and whatever other virus, and even other SARS, you're only contagious from when you're sick and you start coughing and spluttering. So this is quite amazing, this virus, and it's why it's spreading like crazy. Generally, if you're going to get symptoms, it's going to be between the sort of 4 and 14 day mark, basically. Those symptoms, the two most common symptoms are of a cough and of a fever. Okay, so about 80% of people are going to have that get symptoms will have a cough and a fever. You might get other symptoms as well, like a sore throat, runny nose. Some people are even getting gut upset as well, so a bit of nausea and some diarrhea. So that's the main symptoms. About 85% of people are going to just get mild symptoms or none at all. 10 or 15% are going to get symptoms such as severe shortness of breath with this as well, and they're going to end up, a lot of them ending up needing oxygen treatment. 5% of people are ending up needing intensive care unit. That's where the virus has damaged the lungs, and you've got such a strong inflammatory response that the lungs just can't work on their own, and they need to be intubated and ventilated and managed in intensive care. Then the fatality rate from that depends on your general health and your age, basically. So in people over 80, you're looking at a 15 to 20% chance of death from the virus. So it's pretty scary
stuff. And in terms of the best case scenario, when can you sort of see us so-called flattening the curve, or things going back to normal again?
Yeah, look, I hope that these measures that the government's brought in has already started to flatten things out. The trouble is, because of this potential 14-day incubation period, and because of also every test we do, there's between a 1 and 3 day lag depending on where the test's done. Whenever we look at the stats on the government website, you've got to figure that there's a 3 to 14 day lag in those results. So what often happens, if you log onto the government website where they monitor the statistics, you'll often see the tip of the curve. So most of the curve is going up like a straight line, and the tip starts to curl over like that, and you think, yes, we're flattening it. But then in 3 days' time, it's just exactly the same trajectory. I'm hoping that with these measures the government's brought in, that in about another week or two, we actually do see where the curve is going up and then starting to flatten a little bit. The idea with flattening the curve is that even if the same number of people get sick, it's the same number of people getting sick over 6 months. So it doesn't completely crush the healthcare system. In America and New York, Italy, those sorts of places, they're seeing it where basically instead of having a nice flat curve, there's having a massive spike, and hopefully for them it actually drops off quick afterwards. But what happens is with that massive spike, with so many cases, you've got everyone getting sick while the healthcare system just cannot keep up, basically. And that's when fatalities start to go up, as we're seeing.
Yeah, we're very fortunate to have a very good healthcare system here in Australia, and so let's hope that we can see positive things happening in the future with this. And both of us being Port Power supporters, I want to see footy again, mate. Come on.
In all seriousness, though, I think with the AFL, they should just write off this season, and whoever's at the top of the ladder as we speak should be the premiership.
I like it. I like it a lot. No, thank you so much for joining us today, though, Dr. James McLeod. It's always a pleasure to talk to you, mate. Obviously, not the best circumstances at the moment, but I love the job that you do and all your staff up there and everyone else generally in the healthcare world. It's just amazing. We couldn't do it without you. So thanks to you and thanks for your team, and keep up the great work, mate.
Stay safe. If you look after yourself, you'll end up looking after your community and your country. You've got to do it.
Legends with Bevo. Thanks to the Holdie Hotel, Coopers, and Anytime Fitness Glenelg.